So today I'm going to do my very best to offer you a brief overview of our country's healthcare system. This comes on the heels of your exploration into 5 other first world countries and their healthcare systems. And so I'm going to start off today by showing you some comparisons to some of those countries and then talking through some of the logistics of our own country's very complicated healthcare system. This right here is a picture of me and my oldest son, Soren, last year for his 10th birthday. I took him on a trip. I told him he could go anywhere he wanted within reason, and he chose Washington, D.C., which is my favorite American city. So we had a great time last March, and this is in front of the White House. It was freezing, as you can tell. Okay, so just some graphs here. I'm going to whip through these because you can look at them on your own in more detail, but this is pretty obvious here. We spend a whole lot more on healthcare as a country than a lot of other first world and second world countries. And yet our life expectancy at birth is much lower. We're just over 78 years is our life expectancy, and Japan is all the way up to 83 point something. Infant mortality, we're also doing pretty poorly at that compared to other first world countries and a comparable country average. I love this quote by one of my favorite presidents, Teddy Roosevelt, who says, "No country could be strong whose people were sick and poor." There are so many things that this applies to, especially when we talk about social determinants of health, social and racial injustice. And the whole point is that if we are not taking care of the health of our people, we can't be a strong nation and outwardly strong to the rest of the world as well. Okay, these next few slides serve as a brief overview of the history of our healthcare system for the last 100 years. I have a link on the bottom of these slides that can take you to the direct source, but I'm not going to talk about these things. This is pretty self-explanatory. I just want you to be able to read this and get an understanding of where we've come from, how our system has become more physician-focused, how it's become more expensive, how we got Social Security passed, which is a very important law from the 30s, and you can click on the link to learn more. However, it did omit universal health insurance, which was initially a part of that act. How we turned into a system that's mostly employer-sponsored health insurance, and I'll show you stats on that later. And more quotes. This is from my DC trip. This is from the Roosevelt Memorial, so it includes both Teddy and Eleanor Roosevelt in it, and I just love these quotes in here. How Medicare and Medicaid were signed into law, incredibly important healthcare reform. American medicine starts being seen as it's in a crisis. It just continues to be more and more costly. We move towards privatization, corporatization of healthcare. That's a huge shift. We start seeing large numbers of people in the United States with no health insurance at all. Then in 2010, we get the Affordable Care Act. And as you know, things have changed even with that. And so I have some slides on that at the end. The things I want you to be thinking about as you reflect back on the video, the film that you watched, and as you move forward and learning more about our healthcare system, there's 3 things I want you to be very clear about. Who pays for our healthcare? So how is it financed? Who provides it? So how is it offered? And then who has access? Who can actually get the healthcare that we're talking about here? There's 3 ways. There's 3 ways that healthcare is financed: through government, via our taxes, through individuals just paying out of pocket, and then through private health insurance. Sometimes that's co-sponsored by employers. So that's like the middleman, if you will, in financing healthcare. Who provides it? It's either the government or it's individual businesses or providers. And then who has access? Is it everyone? Is it only those who are employed? Is it only those who pay into our tax system? These are questions to be thinking about. Here's some links here and a lovely graph for you on how we spend healthcare. I think it's really important to note to see if you can find public health activity. It is a small sliver, perhaps 1% of our total spending. And let's hope that after our experience with this pandemic, that changes and that we actually decide to invest in our public health infrastructure for the long term. I want you to be aware, if you're not already aware, of the federal agencies that make up our healthcare system on a national level. Don't pay attention to the red Agency for Healthcare Research and Quality. It's in red because this came from their website, so they're highlighting themselves. But under the Secretary of Health and Human Services, these are all the different agencies. In our Canvas course this week, I have a link for you to click on where you can actually learn about what each of these agencies is doing specifically in response to the COVID-19 pandemic. And so that's helpful to kind of see their different roles and how they affect our healthcare. I'm not going to read all these for you, but I have a slide here on what Medicare is. And there's a link at the bottom to learn more. What Medicaid is, there's another link at the bottom. Can illegal immigrants receive Medicaid benefits? This is a question that has come up multiple times in this public health class, and so I thought I would do some research to give a more definitive answer. The link at the bottom gives you more of that, but essentially no, except for there are a few exceptions, so I've linked that there. But here's a list of non-citizens who actually are eligible for Medicaid. So that is in the state of California, we call that Medi-Cal. There is some overlap with Medicaid and Medicare eligibility. So this is another helpful way to look at who is eligible for these phenomenal programs that offer subsidized healthcare for those who could not afford it otherwise. This is a really important program if you're not already aware of CHIP, or the Children's Health Insurance Program. So this is basically to make sure that all children are able to access some sort of health care and health insurance. And so for those children who are in families who make just too much to qualify for Medicaid or Medi-Cal in our state, but are not able to get employer-sponsored health insurance for their families, or perhaps they can't afford the state health insurance exchange that was set up after the Affordable Care Act. So in our state, that's called Covered California, where you can go in and buy cheaper programs through our state exchange. So for families who are kind of caught between, to make too much to afford Medicaid, can't afford other things, we have CHIP. And so this is a federally funded program. It's state subsidized as well, and state run, that offers health insurance to the children in these families. So the adults still might miss out and fall through the gaps, but at least the children have health insurance. It used to be called Healthy Families in California. It's now a subsection of Medi-Cal. And then that's kind of a brief overview of the federal health department. Then there's things about the state health department. What do they do? What are their responsibilities? I have a link to their website there. So I encourage you to click on that link so you can see kind of what they're talking about as far as COVID, what the COVID guidances are for our state, and then other things that are on the radar of California Department of Public Health right now. I have an example here of providing support or financing for the Hep A epidemic in San Diego. That is true, but obviously you can imagine that they're also doing this now for the COVID-19 pandemic. Our local health departments do a variety of things, and I think they have really stepped into the forefront even more during this pandemic, because they are who we are looking to for all of the guidance regarding when and how to reopen our economy and what exactly the expectations are for guidelines with the pandemic, such as when I have gone to visit my parents in Fresno County, and they don't require mask wearing. And so you go into a grocery store and maybe a third of the people in there are wearing masks, even though this is a state and federal recommendation. But our county has been a lot more hardcore about this. I appreciate that about San Diego County. There's a lot of things we've done really well during this pandemic, and that is one of them, is mandating facial coverings when in businesses. If you'd like to learn more, see what's on the county's radar, then you can click on the link there to see their website. And if you want to learn more about the organizational chart, so this is where you can look at a local level, what are the different agencies, just as we have federal agencies for things such as children and the elderly, et cetera. We have those same sort of branches within our own county health department, which is called the San Diego Health and Human Services Agency. And so if you look at that organizational chart, or if you go on their website, you can see all those different branches and what the county is involved in. And it is a lot. So moving forward, as you know, healthcare is always changing. Healthcare reform is always a huge topic, especially in our election cycles. How do we reform our healthcare system? I imagine that after you've explored all that I've offered to you with resources regarding other first world countries around the world, you are thinking, we have a lot of work to do. We have a lot of catching up to do when you look at our data and how it compares. And so here's some more information about moving forward with our healthcare system. This shows you where most people are getting their health coverage from. Most of it is still employer sponsored. And this is for people under the age of 65. That's important to note, because over the age of 65, then it is mostly Medicare. So the uninsured, the questions that we are asking is, who is still left uninsured? Who falls through those cracks? And so I have a video, it's a very short video that I'd like for you to watch that illustrates the different kinds of people in California, of the 3 million in California who still remain uninsured. And then where can they go? Is there anywhere they can go? Well, the answer is yes. And so I have a website here for you to look at. And that's what we call the healthcare safety net. And so these are free clinics that uninsured people can go to. Point Loma has one of them that I'm sure you've become familiar with now, our Health Promotion Center. That's one small example of the safety net, things that are offered to people who have no insurance at all and don't ask for payment. Here's a little bit about the ACA, or the long name, which is the Patient Protection and Affordable Care Act. This kind of has some initial things that were instituted, some things that were challenged by the states, such as that states cannot be forced to expand Medicaid. So there were many states that did not expand their eligibility for Medicaid. California did, however, and was able to include a lot more people into that program. There's a link at the bottom to find out more. But obviously this is slowly being dismantled. So if you click on this link here, NPR Stories, it's really fabulous because it is consistently updated with the most current news stories on what's happening with the ACA. And I gave you just some updates there, but it's got even more since I've added these bullet points. So I really encourage you to look there to find out more. I'm always checking back to that link to see what's happening with the ACA. You probably have heard that there is a movement towards a single payer system. As a country, we call that Medicare for All. In California, we're calling it Healthcare for All, or just referring to it as a single payer system. So you can click on that link. I really do want you to understand the basics of what that means. So please click there to learn more about the single payer system idea. Our largest nursing organization in the country, the American Nurses Association, has a strong stance on healthcare reform. So if you click there, it's really important to know what, as a large organization, we're saying that we want for healthcare reform, our asks, if you will, and our framework for how it should be done. And then finally, this is a really good graphic. And then there's a short video that I want you to watch when you click on that link that kind of explain the idea of Medicare for all, or healthcare for all on a federal level. But essentially what this graphic shows, the top half is showing our current system where insurance companies kind of play the middleman, if you will. And the bottom half shows essentially what Medicare for all would look like, where we get rid of insurance companies as the middleman. And now it's the government. We pay taxes, and then the government pays the providers for treatment. So it's not socialized medicine, because it is not that the government is now running all hospitals and clinics and private practices. It's that the government is paying for those, is paying out to those. So that's why we call it Medicare, because that's how Medicare is set up, right? You're not going to a Medicare hospital, but Medicare is paying your bill for the services there. And so we're going back to those 3 questions, and I hope this provides some more clarity and talks about, compared to other countries, what are we doing, right? So in the sense of when the government pays for healthcare, that's through Medicare and Medicaid, and also through the military and the VA. Who provides it? So again, when the government provides it, so when it's fully socialized medicine, if you will, that's what we would consider for military hospitals and for the VA. And then who has access? And these are the different ways that people have access to healthcare. And so then this slide just takes those same questions and applies it to the different countries that you saw in the video. And so I'll just kind of leave this for you here to kind of look at. That kind of may help put it all together. So that is my, hopefully, quick overview to everything, at least the most important things related to our healthcare system.